And turning to the side here, we have the brain of someone with Alzheimer's disease. Now, pretty much all elderly people will have some degree of brain atrophy. That's just how the brain works. It starts getting old. However, what we can see specifically here in this patient's brain with Alzheimer's is how severely atrophied it is. And something relevant for us here today is that, of course, Alzheimer's is a deadly disease, and you would expect this brain atrophy in someone to lead to some severe cognition problems. However, this is also why Alzheimer's patients are more susceptible to hemorrhages, to subdural hemorrhages. Because the brain cortex is so much smaller, the bridging veins that go from the cortex to the meninges get stretched. So any impact can more easily rupture them. And that's why we also see some other diseases more prevalent, for example, in patients with primary diseases such as Alzheimer's. So here there is a quite interesting and complete video about Alzheimer's that explains the full progression of the disease. And it mentions, for example, tau plaques, and says that it usually involves people older than 80, but can also involve those older than 65. And that's true, because 65 is usually the most common age for people who have a genetic predisposition to it, whereas 80 is more like the age at which anyone is susceptible to it. So let's now descend to the lower floor. And so, here it should be about the musculoskeletal system.